Hello, my name is Mabel Shadende, and today I will be giving an informative speech about FGM or female genital mutilation. This is a trigger warning. Some of the content in this presentation and in the PowerPoint slides are a bit graphic, so please listen and look at the PowerPoints at your own risk. In order for us to discuss FGM, we must first define it. So female genital mutilation, as described by the World Health Organization, is all procedures that involve partial or total removal of external female genitalia or other injuries to the female genital organs for non-medical reasons. So there are 4 types of procedures in which the World Health Organization recognizes as FGM. So first we have the clitoridectomy, which is the partial or total removal of the clitoris in young girls. Type 2 is the excision, which is the partial or total removal of the clitoris or the labia minora. And type 3 is the infibulation. Infibulation basically is when the vaginal opening is narrowed or sewn shut. And type 4 is just a blanket term for all types of FGM. Basically, it could be incision, pricking, burning of the female genitalia. Now that we have defined FGM and all of its types, we must first get into its origin. According to Noor's female genital cutting a persistent practice, the origins of FGM are unknown, but its first known existence was in Egypt, Greece, and Ethiopia. And it was also used in the late 19th century in Western Europe as a form of relief for psychosis and mental illnesses. So currently, it is practiced in over 30 countries, and that is Middle Eastern countries, North African countries, South African countries, and Northeast African countries. It's still being done for girls who are between the ages of 6 to 12, and it's a big part of culture. People who practice FGM in those cultures, it is seen as a rite of passage, as a form of respect. It is seen as an essential part of becoming an adult. Now that we've talked a little bit about the origin, we have to discuss the cultures that practice FGM. So it's practiced today in 30 countries in Western, Eastern, Northeastern Africa, and the Middle East primarily. It's usually in these cultures, the process is practiced on girls from the ages of 6 to 12 years old, and it is believed to improve hygiene and increase a woman's chance of conception in certain cultures. It is believed that by reducing or removing, the clitoris, you reduce a woman's sexual pleasure, and it stops sexual immorality from girls at a young age, and it prepares them for marriage. So supporters of FGM view that it is a part of culture. It is a normal part of culture. And as seen in the paper Female Circumcision, African Women Confront American Medicine, with FGM, it's a part of culture. It's seen as a rite of passage. Women who have undergone FGM are supposedly bringing wealth to their families. So it's a sign of economic wealth. So supporters of FGM view that this practice is normal and not out of the ordinary. It's just a part of one's culture. However, there are people who oppose FGM. So many people oppose the practice of FGM because of the consequences and the dangerous health effects that it brings. So for example, the clitoridectomy, which is the removal of the clitoris, can often lead to hemorrhaging. When you remove it completely, it is found that when you remove the clitoris completely, it is found that it can cause hemorrhaging, meaning that the young girl might bleed for days on end, and it could possibly lead to death. Also, FGM can also lead to acute infections from unsterilized tools. A big part of FGM is that it is performed not it is performed traditionally. Usually, these young women and young girls aren't taken to doctors for the procedure to be performed. They're taken to elders in their culture, or it is done at home. So when you don't have the right tools to perform FGM, it can often cause acute infections uh, that can lead to death. Another factor is the serious pain that it causes. So, as I mentioned, because traditional, it is traditionally done at home, and it is a traditional form of culture. Um, there is no anesthesia provided to a young girl who is having the procedure done. So the serious pain can cause seizures and dizziness and fainting um, in for the young girl. FGM can also cause chronic infections. For an example, the lack of quality treatment for the procedure. For an example, if one undergoes a clitoridectomy without properly treating their vaginal area, that could cause chronic infections that can lead to infertility. Sometimes, because of FGM, young girls have contracted AIDS. So, now that we understand the two opposing sides to FGM, it's also important to see what the current state of FGM is. So over 200 million girls, it is estimated that over 200 million girls have had the procedure done on them. And currently, organizations such as the World Health Organization, UNICEF, and the United Nations are working on a resolution to basically make it a human rights violation. Organization, and I think it's just interesting to see how, from one perspective, it's a part of one's culture, and from another perspective, it is a human rights violation. So,